Good afternoon, doctor, and to everyone who is watching this session. Today we have with us Dr. Ananda Shinala, and today she'll be sharing her insight on the topic of reducing the stigma, engaging open conversation on mental health. So let's start with the conversation, doctor. My first question to you would be, what are some common misconceptions about mental health that contribute to stigma, and how can we address them?
So, it's a very important topic to discuss, first of all. And common misconceptions, it's like there are too many misconceptions. People don't even talk about it, like as if like mind or brain is not a part of our body. It's like we talk about our leg fracture, we talk about our hand fracture, we talk about asthma. We, agar sir mein dard hai, we call ki, or if chest pain is there, we will call all the relatives. Nobody has come to ask us. But if we are suffering from depression or even any family member, any other thing, so we hide it. No, 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 don't talk about it. Nobody should know it. And then we don't call the family members. If then they come, we get angry why they came. So there is a lot of shame attached to the mental illness per se. So there are many misconceptions. So first misconception is like it's like people give it a label, not as a disease. As we say, we are suffering from asthma. People don't say he's suffering from; they will say he is depressed. So that label is a wrong thing. So the biggest misconception is that it is considered as a character flaw and a personality flaw, not as a disease. So first is that, and to burst this myth, it's like I would like to tell it is similar to the diabetes as it happens like there are chemical changes in the body. जैसे हमारे बॉडी में केमिकल चेंजेस हुए, इंसुलिन ऊपर नीचे हुआ, तो डायबिटीज होता है। उसी तरह ही अगर ब्रेन में केमिकल चेंजेस होते हैं, तो ब्रेन का काम है और माइंड का काम है हमारा, हम क्या सोच रहे हैं, हम क्या फील कर रहे हैं, क्या इमोशंस हैं, क्या बिहेवियर है और क्या जजमेंट है। सो जब वो केमिकल्स ऊपर नीचे हो जाते हैं, डोपामिन, सीरोटोनिन, आजकल सबको ये जेन जी तो एनीवेज दे नो अबाउट ऑल दिस, व्हेन दीज केमिकल इम्बैलेंस हैपेंस देन द इलनेस हैपेंस। सो ये चीज समझना जरूरी है कि ये सिमिलर टू बीपी और डायबिटीज है। और सेकेंड में जो आता है कि पूरी जिंदगी दवाई खानी पड़ेगी, कि sir, once you have started, it will be for whole life. So don't you take the tablet for blood pressure? For blood pressure and thyroid also, most of the people I have seen very rarely कि someone stops the medicine. So in psychiatry ऐसा नहीं है कि पूरी जिंदगी खानी पड़ती है. It's because many people stop the medicine in between and then they come after 6 months, 8 months और फिर से relapse होता है. Then the course starts again. So the two myths like which have been busted. Then next is like that mental illness, people call it like crazy कि ये पागल है. Yeah, only crazy people go to the psychiatrist. So it's not like that. It was like in childhood, I am from a family of psychiatrists. My father has a hospital. So if I had to take a rickshaw, I will not tell the name of our hospital कि डॉक्टर रूप सिडाना के हॉस्पिटल जाना है, क्योंकि मुझे लगता था वो सोचेगा ये पागलों के हॉस्पिटल क्यों जा रही है. सो आई
Yeah.
विल टेल द नेम ऑफ द नेबरिंग गायनेक हॉस्पिटल कि वहां जाना है. So that stigma, despite being from the family of psychiatrists, I had. So people today also they call us कि ये तो पागलों के डॉक्टर है, which is wrong. हम पागलों के डॉक्टर नहीं हैं. And now anyways it's time to shift to talk about mental wellness, to shift our perspective from mental illness to the mental wellness, because now the life is so stressful, and in this socially connected world still we are very lonely. Digitally we are connected, हम दूर बैठे लोगों से we are connected, but in the room everyone is on the phone, we don't know what's happening. So that burden, that loneliness is there. So mostly people need the therapist to navigate the stressors of life. So that is the mental wellness part.
Yeah.
And then थर्ड थिंग इज लाइक सबसे बड़ा मिथ है कि वो बोलते हैं कि वायलेंट होते हैं, दे आर एग्रेसिव, ये हमें मार देंगे या ऐसा एग्रेसिव. एंड दिस इज लाइक मेनली बिकॉज मीडिया हैज पोर्ट्रेड इट like that earlier. Now it's changing. Obviously media is also talking about the positive aspects of mental health. And so जो media portrayal which was done, and also like earlier mental hospitals जो portrayal दिखाया गया कि these patients are aggressive, it's not like that. They are not aggressive. Rather they are actually the victim of aggression for many causes. They are being neglected for their healthcare needs. They also have similar health problems, but nobody takes them for the checkup. So that is there. Then lastly, it's like it's they are not treatable. So mental illness is treatable as similar to the other illness. And nowadays, anyways, there are a lot of advances in the treatment. So these illnesses are treatable, and it's not like person is mentally ill. We say person has a illness. So we cannot label a person. So labels are for jars, not for the people. So these are the few myths. And also, lastly, we never say the person of asthma कि there is lot of air around, तुम breathe क्यों नहीं कर रहे? Why are you not able to breathe? You can just snap. And for mental illness person, we say think positive, just snap out of it, which is wrong. This I have seen even with the many physicians and gynecists. They also say that think positive, things will be fine. Why to take medicine? So it is not like you can just snap out of it like this, because it is also the chemical change in your body. So these are few myths, and anyways, if we go talking about it, it can be a long. My thesis was also on this only for 3 years. Yeah.
Why is it important to have open conversation about mental health and reduce the stigma in our community, doctor?
So first, it's very important to have open conversation. Why? Like actually, there is a quote by an author. I forgot the name of the author. Actually, I read her novels and quotations. So she said, what the mental health needs now is more sunlight, more candor, and unashamed conversations. It's like if until and unless we talk about the mental illness, mental health, we are not going to go anywhere. People are not going to take treatment or take help. So it is important to talk about it. And it's nowadays, anyways, it has been changing. Deepika Padukone came and she spoke about her illness. So after that, people started taking therapy, talking about it. Now Alia Bhatt is also talking about the illness. Ira Khan has opened a NGO. So many celebrities are talking about it. And definitely celebrities and Bollywood people talking about anything affects the young generation a lot. So, and other than that, anyways, Gen Z, it has become like a luxury or a fashion thing. I have my own therapist. So talking about it is important. Until we do the conversation, people will not know. उनको समझाना पड़ेगा कि भाई ये पागलपन नहीं है, ये दिमाग की, it is a illness, ये पागल, it's not crazy. So just to remove that label, remove the tag or stereotypes, we have to have open conversation. And once people start talking, that storytelling, if I tell my story, I have been depressed, or any celebrity comes up, any mental health professional comes up, like I have taken treatment, I was on therapy. So people get motivated. It is a powerful tool. So, and also the movies in cinema, like Dear Zindagi is my favorite movie. And that was the best thing which actually busted the myths about the mental illness. And so, cinema can change it, media can change it, and we all talking about it can change the narrative. So, it's time to change the narrative and flip the script to talk about positive aspects of mental health. कि mental wellness इतना हो जाए कि illness तक पहुंचे ही ना.
Right. What are some ways we can encourage individuals to seek help for their mental health concerns? And how can we mental health services more accessible and inclusive?
So first of all, like we can engage people first by starting from the our own home. If I for anything, if we want to bring the change in the society, the change begins from the home. So in our home, if we start talking about our feelings, emotions being normal, then things will change. People will understand कि हाँ, अपने रिश्तेदारों से अगर हम छुपा रहे हैं कि मुझे डिप्रेशन है, तो हम खुद ही उसे बढ़ावा दे रहे हैं. So to talk about it, to have open conversations about how you are feeling, what are you going through, because anyways emotions are normal. Anybody can feel depressed for some period of time, and that is not like treatment for long time. It can be adjustment problem. They a student can be homesick, your girlfriend boyfriend breakup ho gaya hai, then so but talking about it is very important. So change begins from the home to make everyone comfortable to talk about it. Then second comes the schools. In the schools, the workshops should be done for the mental health awareness. If we go and talk in the school and teach them, like mental illness is not a stigma, it is not your fault, you are not at fault for having this disease, and help is available. Seek help, seek therapy, it's very important. Then next comes the media. When media starts talking about positive things, change will come. Storytelling has a very powerful tool. People start sharing their story, it will be important. Then next is the change is like now, anyways, there are many online platforms. So many online mental health platforms has come in which they write blogs, people share their personal narratives, even anonymously one can share. And also you can take therapy also anonymously, even for sexual problems, for mental health issues. So initial therapy can be anonymous, and after 2 sessions, one person himself or herself become comfortable and tells the name. So online platforms have come. They help in at least seeking help. There are many psychologists, many people talking about the change, bringing the change. And there is a thing like on online platform, like there are screening questionnaires. One can screen themselves by applying the questionnaires, whether they are feeling depressed, how stressed they are. So online questionnaires can help. And like the initiative you have taken, Samvad, it is going to reach many people. So people are going to understand it. So as many mental health professionals you can reach, and even not only mental health professional, I will say even the you can do it with the school teachers, school principals. If they also start talking about it, then things will improve. Obviously people will follow. If their principal is telling something about the mental illness or the mental wellness, at least कि इमोशनल रेगुलेशन होना चाहिए, जर्नलिंग करनी चाहिए, ये चीजें, मेडिटेशन, माइंडफुलनेस, so change will begin. So I will suggest this should not be restricted to the psychiatrist, psychologists, school teachers, because teachers shape the future. So you can begin that with the teachers also to talk about the mental wellness, and it will increase your reach. And reaching out, and nowadays anyways everyone is on the screen, so if you make the shorts with everyone, that more people are reached and they will be aware of it. So these are few things which can be made, like. And then
Thank
now PM Modi has come up with Pariksha Pe Charcha, which Deepika Padukone has very beautifully explained it in a very simple language. The stress management. Then there are school mental health programs, college task force have come. So even government and policy makers are coming up with the changes. So now it's the time to change the narrative, like to talk about mental wellness, positive psychology, and change it. Yes.
Thank you, ma'am. Thank you so much. This was very insightful session. Hope people will get the benefit from this. Thank you once again for joining us today, ma'am. Have a nice day.
Yeah, thank you.